Good afternoon. I, Dr. Vartika Mathur, Assistant Professor of Zoology and IQAC member at Sri Venkateswara College, along with Dr. Ambuj Roy, Professor in the Department of Cardiology, AIIMS New Delhi, welcome you all to this third and final webinar of the webinar series on COVID-19, which is organized by IQAC of Sri Venkateswara College and AIIMS New Delhi. In the past 1 month of lockdown period, our physical activity has been drastically reduced, and we feel this immense urge to move out and take a walk at the very least. Sadly, if all of us do this at the same time, the purpose of the lockdown will be completely defeated. Also, we feel confused about the hygiene regime that we should follow during lockdown. In order to guide us about these issues, we have today with us Dr. Gopichandran, Associate Professor in the College of Nursing in AIIMS New Delhi, and he will discuss with us the ways to stay safe and healthy during this lockdown period. If you have any questions, please do type them in the live chat, and Professor Ambuj and I will take them up for you at the end of this talk. I now request Dr. Gopichandran to guide us on how to continue to maintain hygiene and physical activity during this lockdown period.
Friends, students, colleagues, ladies and gentlemen, welcome to the session on staying healthy and safe during COVID-19. Before start my sessions, I would like to sensitize you with that is always you have two questions in your mind, especially during the crisis situations. Number one is why we stay at home. Number two, how to manage, be healthy and safe during COVID-19 outbreak. Definitely you'll get the answer at the end of my sessions. I would like to cover the following outlines during my sessions: healthy activity and adequate sleep, healthy diet and well hydrated during COVID-19 outbreak, how to cope up with the stress during COVID-19 outbreak, how to wear mask and dispose, and what are the hygiene practices and social distancing during COVID-19 outbreak, home care for people who are suspected and confirmed COVID-19 outbreak, and people who need to take extra precautions during COVID-19 outbreak. The best way to prevent COVID-19 is to avoid being exposed to coronavirus. Our goal, that is our national goal, to improve healthy life practices and stay safe during COVID-19 outbreak. Staying physically active is one of the best way to keep our mind and body healthy. The health means it's a complete well-being, which include physical health, mental health, social health, spiritual health. You have to attain. If we ignore any one aspect of this, definitely resulting in poor health. So what are the healthy activity and adequate sleep at home during COVID-19 outbreak? Doing any activity around the home is better than nothing to do at all. Be active during COVID-19 outbreak to maintain your health, especially the heart health and muscle strength and flexibility. It is good for your mental health too. As per recommendation from WHO, the few guideline is given for maintaining your physical activity. Number one, try exercise classes online, which will be more reliable and flexible, which you can able to practice at home, and dance to the music, because dance also one kind of the physical activity that will encourage you, occupy you physically and also improve your mental health too. And play active video games. So what are some of the video games may engage you physically, that also occupy with you during the time of your crisis situation. Try skipping rope. As you know that this is when you do skipping rope, you may not require more spaces. When you are at home, you can try out for the skipping rope. That also make you to be more engaged physically. do some muscle strength and balance training exercises. You can do with some of the range of motion exercise. You can do, you can focus on each muscles. That gives you more active of your body and also give you more fresh during the time we are staying at home. So also WHO recommend that all healthy adults do 30 minutes per day of physical activity, and children should be physically active for 1 hour per day. Even still, you can increase your physical activity according to your energy and also according to your time, which can be permit you. So, but still minimum as per the WHO recommendation, you have to do physical activity for 30 minutes for the adult, 1 hour for children. Again, now all are at home. We do some of the work at home, or again, you are limited to go outside. So in the situation, you may be busy with the mobile or maybe watching the TV. So WHO recommend you to regularly check your sitting posture while working from home to prevent some kind of the illness like a low back pain, or maybe you maybe have the issue like musculoskeletal problems or maybe muscle contracture. And same time, you also breaking up your sitting and stand up while working on the phone or watching TV. So you need to stand up and move every 30 minutes and help you to be prevent these type of the problems. Again, WHO given few tips to improve your physical activity. If you are living in multi-story building, you can do walk up and down the stairs and do some stretching exercises and dance to music for a few minutes and seek more idea resources in online available. That also you can look into that. You can practice it for better in your physical activity. So overall, to conclude about the physical activity, keeping active every day is good for your body, mind, spirit, especially during this stressful time. And more physical activity you can do improve your sleep, which also important for your good health. So is it need any healthy diet and hydration at home during COVID-19? Yes, you need special concern about the healthy diet, and you need to drink, or you can say hydrate more fluid as much possible at the time of, especially in the when you stay at home. So our WHO recommend that you need to have well balanced diet even you are staying at home, and enhance your immunity by consuming diet which are higher source of amino acid, iron, vitamin C and zinc. And again, we are advising you to drink more fluid that help you to improve your digestions and also to improve metabolic activity. That's why we advise to have that more water and well balanced diet. When we talk about a healthy diet, is whatever you practice day to day that you can do. And especially when you serve the food, you should eat more fruits and vegetables. Choose whole grains and over refined grains, and always prefer eat smaller portions than bigger portions. Replace saturated fats with unsaturated fats, and limit foods that are high in fat, sugar and salt. Especially you may be diabetic or maybe hypertension or other systemic illness. Again, you have to limit the alcohol or smoking, other bad habits. So how do you cope up with your stress at home during COVID-19? That everyone know that you are at home, you are facing the crisis situation. The stress is common for everyone, including the public, including the health worker, and including the government also. So everyone, we have different kind of stress. Still, we have to overcome. So we must know what is stress. The stress means which is when we face unwanted situation, unwanted events which is happen. You trying to overcome that. You need you have to understand what type of stress you are perceiving, and who are all facing the stress situations, and how do you cope up the things. That all have many strategies to overcome. The stress is common. It is varied from one family to another family, one group to another group, and again one individual to another individual. Again, we also must know that managing stress by your different strategies that you have to through WHO have recommended few strategies to overcome the stress management. If you are adult, if you are living at home, You may be busy with many activities earlier. Now you may stuck. You are not able to perform your day-to-day activities, and you may limit it to your spiritual activity, your social activity. So WHO is recommending that definitely everyone have to come into that the feeling sad, stressed, confused, scared, or angry during the crisis situations. So talking to the people you trust can help. Contact your friends and family. If you must, definitely stay at home, maintain your healthy lifestyle, including proper diet, sleep, exercise, and social contact with the loved ones at home by email and phone with our family and friends. But you should always to prohibit smoking and alcohol and other drugs to deal with your emotions. If you feel overwhelmed, talk to the health worker and counselor. Have a plan where to go and how to seek help for the physical and mental health need if required. I think everyone know that there is a different platform today to seek the informations. Still, we always to sometimes follow some of the information which is not be accurate. So that's why we always some advisory guideline which is given by WHO and CDC and also Ministry of Health. That is the one which have the reliable sources to follow. That should be always advised to every individual in the society to follow, and then as per the recommendation to improve your health and also to prevent the outbreak of the COVID-19. And same time, we may have worries and agitations. So we can overcome with your families to spend with your family and by watching and listening to the media coverage that you perceive as upsetting. And again, your few skills and experiences. You may good with the art of living, or you may be good with counseling skills, or maybe you are good with some of the meditation, yoga, that have that experience definitely overcome in your emotional situations and in your feeling stress. And not only for you, you can also to help your family to overcome these stressful situations, especially at the COVID-19 outbreak. And again, earlier I stated the stress varied from one individual to another individual, one group to another group. So again, the children may respond to the stress in different way, such as being more clingy, anxious, withdrawing, angry, agitated, and bedwetting, etc. Respond to your child reaction in supportive way, listen to the concern and give them extra love and attention. And again, children have highest energy, maximum energy in your family. They may not able to drain out. They may depressed, sometimes they agitated. So give them chance to make them play at home, and possible make opportunity to child to play and relax within the premises. And also you can also guide them such a way to overcome this crisis situations. And always try to keep children close to the parents and family. Avoid separating children and the caregiver to the extent possible. If separation occurred due to hospitalization, or ensure to the regular contact. So till that, for the reassurance, we can make them bring back to that the normal as usual. Again, there is always the children's, they don't know how to manage the timing at home. You help them to regulate their routine and schedule as much as possible. They help create new ones in the new environment, including school and learning, as well as time for safely playing relaxations. So example, you can give you can advise the children, make their plan of the day, like morning they can do like their any classes, online classes, or any regular activity which is related to academic. Afternoon they can do some play activity, they can use their any type of online games or maybe any other game that can do physically within your premises at home. Again, before going to sleep, they can watch out some TV or some of the entertainment activities. So make them to be busy in the schedule, that maybe they come out from that their stress, and also they'll be enjoy with the day with same like other day. They're providing fact about what happened and explain what is going to be now, and given them clear information about how to reduce the risk of being infected by disease. That also to understand them, even though they may not understand, because we know what is happening, why we stay at home, but children may not know that. You have to explain to them in their language, in a better manner, because as they are also one of the person in the family, in the society, They may also transmit the infection to the others. Their hygiene practices, their safety measure also to break out the chain of the infections. So again, when you talk about the safety at home, the Ministry of Health Family Welfare given basic some of the protective measures for the all individual at society. Wash your hand frequently, maintain social distancing, avoid touching your eyes, nose and mouth, practice respiratory hygiene by covering your mouth, nose with your bent elbow and tissue when you cough or sneeze. If you have fever and cough, difficulty breathing, seek medical care at the earliest. Stay informed and follow the advice given by your doctor. See a doctor if you feel unwell. While visiting a doctor, wear a mask, cloth to cover your mouth and nose. If you have any symptoms, please call state helpline number or Health Ministry 24/7 23978046 with the Delhi number, or email at novel COV, that means novel coronavirus ncov 2019@gmail.com. How to put on, use, take off and dispose of your mask. As per the WHO guideline, we supposed to wear mask, especially even today as per the advisory from Government of India, we should wear the mask in public place. But as per the reality, sometimes I can able to witness that they are not wearing mask. They may be the reason they don't know why we wear mask in public place. Look into this picture, the COVID-19 carrier with mask, the healthy contact like you with mask, the transmission probability is 1.5%. Again, the COVID-19 carrier with mask, if you are not wearing mask, transmission probability is 5%. The COVID-19 carrier without mask, but you are wearing mask, the transmission probability is 70%. That means if you are going outside of the home, you may find any of the carrier. The person may not be symptomatic. He is not, she or he not wearing mask. The chances of the probability of the transmission infection is 70%, even if you are wearing mask. That's why we advise everyone today we may not know who is carrier. So everyone advised to wear mask. That break the chain of the infection and also that contain the disease. So, but same time, the Government of India advised wear any type of face mask, including the cloth mask, definitely to help out and reduce the transmissions. When to use your mask? For healthy people, wear a mask only if you are taking care of the person with the suspected COVID-19 infections. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it properly. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover mouth and nose with a mask and make you sure that there is no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. To remove the mask, remove it from beginning. Don't touch the in front of the mask. Discard immediately in your closed bin. Clean hands with alcohol-based hand rub or soap and water. Again, there is a huge demand today to get the mask. Some people say that I don't have the mask. So again, CDC recommended. You can wear, you can use your t-shirt or only just you need scissor. You can make it that type of cloth mask. Your no shoe method is there. So you no need to worry about it. Still with your t-shirt, you can make your own mask that can wear it to prevent or protect yourself. So what are the hygiene practices at home during COVID-19? The good hygiene is in your hands. Wash your hand thoroughly with soap and water for at least 20 seconds to prevent passing on germs, and dry your hands too. There are, as per the WHO recommendation, there are 6 steps technique for hand wash. So rub palm to palm, rub palm over the back of the hand, finger interlaced. palm to palm finger interlaced, finger interlocked into the palm, and rotational rubbing of thumb clasp to the palm, and rotational rubbing of clamps to finger to into the palm. So these are the common techniques. Still, I just want to revise to you, or maybe to sensitize you, because the minimum 20 seconds at least you have to perform your hand washing. That definitely will help you to protect yourself and also to others. Wash your hand with the soap and running water when hands are visibly dirty. If your hands are not visibly dirty, frequently clean them by using alcohol-based hand rub or soap and water. Protect yourself and others from getting sick. Wash your hands after coughing or sneezing, when caring for the sick, before, during, after you prepare food, before eating, after toilet use. Wash hands are visibly dirty after handling animal or animal waste. Again, when coughing and sneezing, cover mouth and nose with flexed elbow or tissue, and throw the tissue into the closed bin immediately after use. Clean hands with alcohol-based hand rub or soap and water after coughing and sneezing and when caring for the sick. These all is a guideline given by World Health Organization for protect yourself and protect others. Some situation, definitely you may need something essential item to go outside, especially for going to the grocery shopping. Keep at least 1 meter distance from others. Avoid touching with your eyes, mouth and nose. If possible, sanitize the handles of shopping trolley baskets before shopping. Once home, wash your hand thoroughly, also after handling and storing your purchased product. But there is so far currently no confirmed case of COVID-19 transmitted through food and food packaging. Once you come back to home, how should I wash fruits and vegetables at the time of COVID-19? Wash them same way you would in any other circumstances. Before handling them, wash your hand with soap and water. Then wash fruits and vegetables thoroughly with clean water, especially if you eat them as raw. So again, we are also witnessing that very difficult to do social distancing. Still, the government is taking a lot of measures, and police person also keep on helping you, guiding us to do the social distancing in public places. But we are giving this session to make you to understand why do we do social distancing. So, and also we have to ensure that you are what type of social distancing you are doing. So we want to, first of all, we should avoid large gathering and maintain the distance of 3 feet. That means 1 meter from one to another when you go for any public places for buying material or any other activities you are going. So we have to ensure that why we do this. What is the vital importance of social distancing? Definitely it reduces that social contact. That again help you to reduce the spread of the coronavirus. Few data already as however that other countries who have experienced the COVID-19, they follow the same strategy, the way they contain the disease. So definitely as per the disease prevalence, one person only infect, he can able to transmit the infection to 2.5 to 3 people within 5 days. That means the end result within 30 days you may get 406 people may infected. If you do this social distancing, then definitely it can be minimized with a very, very less contact. If you can say that 70% less contact because of your social distancing and your stay at home, it can be maximum may ended with 2.5 people at the end of 1 month. That was our strategy today, because there is no vaccination available, no treatment protocol. We are still the health worker and government and including WHO trying to find out the solution to treat the disease. So still we want to improve the outcome, to want to break that chain, and you want to reduce the number of the infection or to contain the disease. The social distancing, wearing mask, these are the most important strategy, including hand wash, that help to contain the disease. How to do the care, especially home care of people during COVID-19, especially if we have suspected and also confirmed COVID-19 patients. If you are ill persons, You may have a symptom like fever and cough. You should clean hands frequently with soap and water with alcohol-based hand rub, and better to be stay in separate room from other family member. If not possible, you may have a very single room house. You can be maintain the distance 1 meter between everyone, and at least you try to use one dedicated bathroom, that to help to prevent the infection to others. And stay at home. Don't go for any work, school and public places. Take rest, drink plenty of fluids, and eat nutritious food as much possible. When coughing and sneezing, cover mouth and nose with a flexed elbow or use disposable tissue. Discard after use immediately. If you are experiencing difficulty in breathing, call your healthcare facility immediately. If you are a member of the household, wash hand with soap and water regularly, especially after coughing, sneezing, before, during, after you prepare food, before eating, after using the toilet, before, after caring for the ill persons, when hands are visibly dirty. When coughing or sneezing, cover mouth and nose with a flexed elbow and use a disposable tissue and discard immediately after use. Avoid unnecessary exposure to the ill person. Avoid sharing items such as eating utensils, dishes, drinks, and towels. Monitor everyone's health for symptoms such as fever, cough. If difficulty in breathing appear, call your healthcare facility immediately. So these are the guidelines given by WHO. If you are as an ill person, you are at home, you are suspected and confirmed the case of COVID-19, and even that family member, they also take care of themselves, and also they are to break the chain of the infection and protect themselves and protect the patient further for derivations. The people who need to take care extra precautions during the COVID-19 infections. People at a high risk for severe illness, like old people who have the systemic illness, like the diabetic, hypertension, cardiac problem, respiratory problem, for the old age persons, or maybe any persons who with cancer, so renal diseases, any chronic illness, so autoimmune disease, they are all need to be more care during the time of COVID-19 infections. And other people also like vulnerable people like pregnant women and people experiencing homelessness, people with the disabilities. So that whoever the old persons, the people who have severe underlying medical conditions, as I stated earlier, they have to follow their proper medications, whatever already prescribed. They should also keep store their medications, and they should not delay getting any emergency care for underlying conditions. And call your healthcare provider if you have any concerns. Today, we have telemedicine facility available at AIMS and some of the other hospitals. You can contact them for your any follow-up, and also you never stop any medication till the further consultation by any specialist related to the conditions. So at the end of my sessions, I hope you got the answer. Why we stay at home, how stay safe. Stay home, stay safe, and we are there to help you. The take-home message for my sessions: make the most of your time during COVID-19 lockdown, and stay positive. Use the time for productive activities. Follow government guidelines and stay safe.
Thank you so much, Dr. Gopichandran, for such a such a valuable information, and something that all of us at home are going to utilize. And this is something that constantly we keep thinking about. And sir, today instead of I'm not going to let you be the host today. Today I'm going to ask you as some questions and as expert also. So let us start asking questions to Dr. Gopichandran. Ritu Dhingra and Vijay Lal, they have asked questions. So I'm going to keep combining the questions. Can we go for a walk in the park if no one is there? And what are the precautions that we need to take while going out now, like now, especially after this lockdown is over?
It's a very common questions. People most commonly they asking this type of issues during the lockdown period. But I know the last 2 days our experts mostly talked about importance of physical health and mental health. But today we mostly my talk which is related to the overall aspect of the health. That means social, spiritual, all aspect. Because during we have two challenges today facing: how to manage the lockdown and same time how to fight with the COVID. Even we don't have any weapon, still the productive measures only to able to manage that COVID-19. That question definitely all the time. Yeah, I've seen that somebody even I'm living in the place where I can able to see they are walking out at the evening or sometime I able to watch out. But as per our advice, we always restrict. Even our park also closed, but still people are walking out. But if you are really sometimes we may not limit everyone which way due to their stress, due to anxiety, maybe especially some of them not able to cope up the situation, they go out of the park and they do walking if really they want to go. But it's not thing that who is there, we have to make ourselves to be protected, that by wearing mask, by maintaining the distance which will be prescribed, but trying to avoid is better. Because if someone go, another one will insist go, another one will go, it become more mass again. We cannot able to which we expected the government to do to protect us, that may be failure. So that's my advice, try to avoid. If you are insisted, if you think that you want to go due to manage your stress, you want to open up yourself to go outside, then please take care of that things, following precautions which is advised. Again, after you, before going, clean your hand and do better good hand hygiene. And again, when you again go out, your respiratory hygiene is most important. And during the time of walking, you have to make sure that you are to be away from anyone
And
and
preferably
maintain
not
that,
to touch a lot of
not touch any
surfaces.
places. Again, after you come back, please wash your hand, because a cleaning hand is the most important to prevent this type of infections.
Yes.
So I mean, you can do this physical walk, but you have to assure
Yeah,
you're
sure.
maintaining 2-3 things: wearing your mask,
Yeah.
having adequate social distancing, and make sure that, as you said, don't touch public places,
preferably.
gates, and you would invariably open the gate and touch
Exactly.
those things. So make sure that you don't touch your face, eyes,
Yeah,
with that,
mostly
and also come back home. Make sure that you wash your hands.
So the restraint should not just be by the government, but for our own selves.
Yeah.
So we should restrain ourselves after the lockdown is over. Ambud sir, Shikha Jain and Babita Bhardwaj, they wanted to know that once, okay, after the lockdown period, for some time the educational institutes will not be opened immediately, but whenever they open, now our Delhi University says that the guidelines, the UGC is saying that it's going to open somewhere probably after 30th June. So, in whenever that happens, what are the precautions that we should take? What are the do's and don'ts in any kind of big social gatherings like in college or in schools, or especially when you're in a residential? Some institutions are in residential areas.
Yeah, I mean, it's obviously a very genuine concern. And we all don't have a very definitive answer. It's a very dynamic situation. It really depends on how these things. I don't see it opening in the very near future or institutional colleges, but so it'll really depend what the dynamics at that point of time is. But then the general advice will be the same. What we spoke about. What I yesterday also said was COVID etiquettes. Now we have to build them up. We have to be with masks for another 6 months to 1 year. We have to live with that. We have to have good hand hygiene practices have to be done. And once we open up, even say, suppose you're talking about a hostel. So again, we have to restrict ourselves to our rooms. Those common places of, those common rooms, the TV rooms will have to remain shut. We'll have to maintain those social distancing norms. Use, even in that time, as far as possible, use the tele-education, e-learning platforms. So now we become used to somewhat. At AIMS, we are using that very successfully for MBBS, PG, for nursing college. We've used that platform for teaching. So that should again be promoted. So we have to combine these strategies. I don't think one size fits all will be possible for all institutions. So every institution will have to devise its strategy, keeping these fundamental pillars of COVID etiquettes, as I said, in mind, and use as much distancing as possible.
Yeah. As during Dr. Guleria's talk, also we said that it's going to be new normal.
Yeah.
The education system will have to completely.
That's the shifting. We trying to
refurbish.
adapt it.
But based on that, sir, Amut sir, Shruti Singh and Ranjana Roy Mishra have asked that now, because so much of technology, we are going to be tech savvy out of compulsion. So how do we help our eyes, not only just our eyes but also our children's eyes, because they are constantly glued to these e-learning things, and plus after you finish the classes, online classes, then the children, they want to play some video games, they can't go out, and then we are stuck to our WhatsApps, our social media, and then there is TV, lot of Netflix. So how do we help our eyes?
So I mean, we're all struggling with that at our homes, but yes. So I would really divide it into some of the necessary evils and some of the avoidable screen times.
Yeah.
So obviously now you are all the schools are running classes online. Children are on online for 4 hours, so they have those necessary evil, if I may say, of learning on computers.
Yeah.
So that has to go on, but I'm sure we will have devised ways of engagement out of screen time for the rest of the hours. Yeah, so and that's difficult, I know, but that's something which we all of us. I mean, why blame the children? I mean, if you see the WhatsApp usage, it's gone up phenomenally, and the forwards and the knowledge. A lot of
everybody is glued to the
Yes.
stock markets
So,
or
The way
news.
we
Everybody
engage
wants
our
to-
life in
everything
that
about
such a
this.
way.
So a lot of things which Gopi said during our talks, like let's have discipline in doing.
Yeah.
So you have time, do those exercises at home. I was amazed when I actually during the lockdown I learned there are so many apps and there are so many very nice websites which help you do a varied venue of physical activities at home.
Yeah.
So there could be very light
Light.
exercises, light yoga stretches, and there are so many good apps which can help you do that. Then there are other apps which you can do, and if you're more, fitter like you are, so you can do the more intensive exercises which really make you sweat out, like the night.
Jhadu pocha is enough intense
No, that's
exercise
also a
for
good
me.
exercise.
One thing I add with that, sir, actually the children's, because I'm also the parent of 2 kids. We have to see they are addicted with the video games sometimes. That we have to watch out. We have to closely monitor. It's a parenting. It's the most important.
So that's true for other times also.
Yeah,
So,
that's
But in this time they are less academic activity. They intend to go with it, but still the parents are at home. That's one of the good things happening right now. But if you because that you say that is something in the issue with eyes which will happen. So better when instead of what she says, so we are learning many new things from this during this lockdown with learning exercise, so many things through the app. At the same time, you have to watch out very closely with children. We should not occupy more on that. That will help them after lockdown. It may affect on that. That's
Exactly. And I think this is a good time to bond with the children, play more board games, do something more constructive with the kids. So we'll have to really
watch out for the night skies.
yeah.
Rarely
Also,
and rarely
yeah,
you get to
it's
see
the
the stars.
best
And
time
the
to
other
do
day,
that.
there was a very nice app, and you can explore the stars, the constellations,
Exactly.
in your night sky.
Yeah.
Probably won't get that once we get out of.
Start with the finish with the lockdown. Speaking of the physical fitness, Chaitanya Jadhav is asking that how, like, as a healthcare workers, how do you promote yoga, asanas, various asanas in AIMS? What do you do for
actually,
healthcare workers?
Sir said we already are pioneer in e-learning platform. Same like we are also pioneer in educating the patient, even nurses or health worker to do practices yoga and meditations. It is not doing right now. We do since many years. And Dr. Gautam Sarma is the professor in charge of the yoga center.
Yes.
And we also integrated with integrated medicines and also with Ayush medicines to do so many studies and also do so many activity exercise on base of the yoga and meditation. So this is now it become more important right now because whatever we learned, even I learned something related to PMR, yoga, meditation that help us in our myself and my family, and we are teaching. Because now we are restricted to the social activity, spiritual activity. When we are not able to go out, this type of exercise help to come out from like what yesterday Sir was discussing, anxiety, stress, emotional problem, depression is very common due to this lockdown because when we restricted ourselves. That we do simple like breathing exercise, yoga, pranayam, these all activity definitely help us to come out. and same time we have time to teach our children. So they are also learning, and we do some of the yoga with a family manner. It is not only alone. That also helping us, because that's really it's we are doing at aims. We have learned, and same time if we can, everyone can take up these messages and try to practice. But this also available in online. Now
Online,
yoga class
there are
are
lots
available
of
online.
apps, yeah.
They can learn themselves. There is a mentors are available. They can guide. I think hope it will become.
So AIMS is continuing with its there are several research protocols
Yeah.
with this like
Yeah.
CIMR, where they're continuing with on the E platform, teaching the participants on the yoga and the asanas. So that's an ongoing process.
Oh, that's very nice.
It's good. It is actually it is helping out the stress who are facing. We have a healthcare worker also.
Yeah.
It is not only family. We are in the
Yeah.
COVID situation. We are facing a lot of stress due to manage the situation system.
Yeah.
It helps us also to come out.
Yeah, that is true.
Yeah.
So true. Yeah. Sir, Jitu Patel is asking, is requested you to share your insight regarding hydroxychloroquine as a prophylactic treatment. I mean, you're the heart specialist, so the question is directed to you.
So for several reasons, unfortunately, our hydroxychloroquine has become the most abused drug in our recent times. So I'm very clear about it. The ICMR has very clear guidelines on hydroxychloroquine use for prophylaxis, and it's to be used only by healthcare workers who are even healthcare workers who are involved in treatment of COVID-19 patients and of high-risk close contacts of people who have tested positive. Those are the only two subsets of patients, subset of individuals who are prescribed to take hydroxychloroquine. Even outside this, there is a request I would like to make. Please do not self-prescribe, self-medicate with hydroxychloroquine. There can be serious consequences, and there have been reported serious consequences on use of hydroxychloroquine on its own, leading to, as you know, what it does is it prolongs the recharging of the heart and leads to thus missed beats and ventricular tachycardia, or what is irregular heart rate, or the stoppage of heart. So please do not use it outside of medical prescription. It is not to be self-medicated at all. In fact, even I would go to add to say that now the studies which are emerging is showing that it's not very useful even in the trials. Okay. So do not self-medicate. Do it only on the prescription. Of a medical practitioner.
Okay. In fact, somebody from Belgium had yesterday emailed me to ask whether there's a correlation between a person taking Ecosprin and the hydroxychloroquine.
No, so not hydroxychloroquine, but there's another drug which is used for COVID-19 management, which is azithromycin. So both, and there is another common antibiotic called chloroquine group of medicines like ciprofloxacin or ciprofloxacin commonly used. And there are several other drugs which increase long QT. So when you combine these two drugs together, like if you take azithromycin and hydroxychloroquine or chloroquine together, there's a higher chance of this long QT happening. That is the prolongation, the recharging of the heart muscles, and then it increases your chance of having these abnormal heart rhythms.
And so the people who are taking these blood thinners,
so blood thinners, I would say anyway. You have to look at other, it's not the blood thinner which interacts with hydroxychloroquine, but there may be other cardiac medicines that this person may be, because he's on Ecosprin, and the cardiac conditions. So if you have a weak heart, then you are more susceptible to these arrhythmias. So such patients who already have cardiac conditions or who are on other medications must especially be careful before they start hydroxychloroquine. They must make sure there's a whole host of medicines which interact with hydroxychloroquine to further prolong this QT interval. So those patients have to be especially cautious, and they must ask their physicians whether there are other drugs which are interacting with this, which may worsen
the conditions. Yeah.
So you have to be very careful.
It should not be basically taken on our own as a prophylactic drug.
Actually, it's not a panacea for prevention of COVID.
Sweksha Sharma and Namita Nair have asked,
can we, like, so when we go to markets, and even actually I will add a question from Praveen Bhardwaj, that can we reuse the mask, because constantly throwing away the mask is a big hassle, and can we reuse the mask probably after washing, or should we dispose them after one use, or can we, if we are just going to buy milk or for a very short time, can we keep the mask, how to keep that mask safely if possible, and what are the precautions to be used, and how do we and finally when we have to discard the mask, how do we discard such a mask, especially with when we are kind of a little bit apprehensive that we have come in contact with a person who was probably COVID positive, or coming to a hospital, for example. So you may have more
actually,
chances.
it's a very right question. So most of the time we are able to watch out when I am able to see they are going out. Sometimes they touch the mask, and sometimes they handle in proper manner. And again, they are also questioning their mind whether I can reuse it. First of all, they understand that now that as per the advisory government of India, everyone to wear the mask, because we don't know when you go out of step out from home, we don't know who is carrier. So if the person not wearing mask, you have already I mentioned during my session also, you have chance to get 70% to get chance to get transmitted infection. So wearing mask is mandatory. But again, government again advised us use any kind of mask will do for that to protect you. That means that we can use cloth mask. So that you can make it from your own. That I also during the time my session I explained to you. But when you use that, you keep 1 or 2, 3 masks. That's preferable for you to use it. That make number 1, 2, 3, 4. But we know that already, sir was also discussed, the maximum viability of the virus, maximum 72 hours. The same way also we are health worker using N95 for same 4 mask, we keep it for rotation. Same like we can use any mask for 1 day or even time maximum hour. If you use it for 8 hours, you discard it. You can use it, you can wash it and reuse it. If you use for half an hour, 1 hour, you keep it in safe places, but should not be very moist. Should
So
be
maybe
dry.
in an envelope, for example.
Anywhere, but should be dried. First of all, you dry it. Hang it is better manner. It's become more dry, and again you can reuse it. But that when you reuse it, you have to make sure that we keep 2 3. That one you can use it for after that 2 days you can use it.
Okay.
So otherwise you wash it and dry it again use it. That's manner you can able to keep 2 3 masks to use it for regular manner. But when you are again, sir, anything you wanted?
So, what essentially for the layperson is the cotton mask that you should be using.
So, what is a kind of material that we should use?
So, that's a very relevant question. So, it should be a relatively thickish material, and one good way of checking that is if you put the cloth against the sunlight, a very minimal light should pass through it. Okay. So, if you have a thick kind of a material like pillow cover materials is good for making it. So that kind of material is what is recommended. And if it's a thinner material, then make a 2 3 layers of that mask. The government of India had come out with an advisory on how to make those homemade masks. If you have a sewing machine, how to make it. If you don't have, then there is also a way to make it. This is available online, even at the AIMS website and the ministry website, on how to make a mask at home. So it gives you 3 4 layers of cloth so that the filtering is improved. But coming to the question of reuse, all cotton masks can be reused. But what you have to do is preferably every individual of the house should have at least 2 masks for himself. So he uses one on 1 day and then washes it. Washing should be preferably in warm water, and as far as possible, try to hang it out in the sun. Thankfully, we have good sun, so if you can hang it out for 3 4 hours, that's good, so that you can use it next day. If that is not possible, iron it out. Okay. That's another way of reusing the mask. So once you've washed it, you can iron it out, so that the heat is known to destroy the mask. Preferably, if you can wash it in a little warmer water, that's also good, especially if you are, as you said, you've come in contact with somebody else. And for the other type of mask, surgical mask, again, disposing it is a bit of an issue, as you said. So mostly the surgical masks should not be reused. They have to be disposed of. They're single use. So if you really suspect that and don't want to spread infection through it, maybe you could put it in another plastic, a small or thin or something, wrap it up and then dispose it in the usual trash, so that you don't spread infection through the mask itself.
Okay. Is it possible to kind of sanitize it? So if you put a sanitizer on such masks and then throw it off, because a
Yeah.
person who's handling the person who's handling the garbage.
Yeah.
So,
So that
these people
Yeah,
also
that may be a good way to.
That may be the good way, but hand washing before and after,
After
use, that's the
use.
most important. But because cleaning hand is the most important, even I still that wearing the
Yeah,
mask
and we
because
have this habit
the
of
entry of the
constantly
organism only by hand.
touching our faces. So, yeah, that's a good. Sir, one more question that Surbi Agarwal has asked, that it is said that the virus adheres to paper. So, how do we handle the money on newspaper, for example? So, what do we do with it? Should we leave people are leaving the newspaper outside for a day or something like that, reading one day old news? What do you do with the money, for example?
No, actually, even WHO website also they given very clearly there is no evidence such evidence this transmission of the virus through either one. We, even yesterday also we discussed either vegetable or fruits or
Yeah.
even the currency, but still hand washing. I can say all the time, wash your hand when even before touching your note and after handling the notes. That may
So use the
Yeah.
e-platform to pay as much as
Yeah.
possible in your
because
daily
see
and everyday.
why I'm telling you may think that why before touching, because you may have virus, you may touch the currency, you may transfer to that, because it's not you protecting yourself, you protect others. That's the most concern. So hand washing and hand when you are handling, before or after handling, that make the things more better. Otherwise you may not use any sanitizer or something to clean note, but only but coin aspect you can do that. But still I don't want to be very panic on that issue handling this, either even vegetable or maybe handling that.
I think outside the body, the virus has a short life. So, normally, if we keep things away, the surfaces in general, so for some time.
So whatever is cleanable, you can clean. The virus it can
Yeah.
has been shown to stay on surfaces for 6 to 8 hours and on metallic surfaces for even longer. So that's what we say, like things which are frequently touched, like the door handle,
Yeah.
the knobs,
That
the
is a
railings of the
sanitizer.
your
For
house or
public
your
place or a
apartment. That
staircase.
should be
Yeah.
frequently cleaned.
Yeah.
Whichever can clean. I don't know how you can clean your newspaper.
That's why
you can minimize
minimize
contact and
contact.
keep washing your hands. That's all.
So, sir, are there? So, how do we, for example, keep cleaning our bags or our purses? In general, also, it is said that the base of our purse, the ladies' handbag, it's one of the dirtiest.
And your mobile phones.
No,
also.
And mobile phones,
Yeah,
yes.
actually, especially who are working as a healthcare professionals, when they go out of this home for work, time for work. Even I was discussing at time of when you're talking webinar to the nurses. So we have to be very careful. We should try to avoid that, especially you are working in COVID-19 unit. We should be avoid to bring that mobile or whichever electronic item which is not mandatory take it. So that really be one of the more to transmit to your family, to the public.
Yeah.
So if you are use it, that what you say, no, we can use swipe it with a sanitizer, which should be necessary. But so again, as yesterday Dr. Nandakumar said, don't be preoccupied more to clean all the area. I think that make it more panic and anxious,
more
because
anxious, yeah.
we are very casual right now. We are taking to the new challenges, but we be conscious. Every time we say be smart, be confident, be positive, and so that's make the things are more clear, and we can go ahead with your all the challenging situations.
Yeah. So there is a question that said that in an unfortunate situation where a person has passed away due to COVID-19, what kind of precautions should the family members take? And how does AIMS deal with that situation in terms for family members, and how you are still keeping in terms of like keeping in line with the tradition and then still staying away from the disease? What do you do?
So again, for this, for greater details, there is a very detailed document by the ministry, which was designed at AIMS and other experts who have given how to handle a dead body. There's a lot of panic, and we've seen that with doctors who were not given a decent cremation and ceremony, which is very unfortunate.
Yeah.
There are very definite guidelines on handling these bodies. So I would generally say all the hospitals are giving you body bags to be used for in the case of unfortunate death of a COVID patient. So that has to be done. The person handling it should preferably be wearing gloves. You should try to avoid contact with the body as far as possible. And again, at the end of it, you must have good hand hygiene. That will really prevent all. See, once your person is deceased, he does not spread the virus in a normal way. He's not
Yeah.
breathing. So there's no fear of transmission in that way.
So the person's clothes or the person's
Yeah.
Yeah.
touching.
Normally, the hospital would process the body
Body.
Okay.
and do that so that it's
We
disinfected
have a
completely.
protocol.
So and those protocols are completely
Yeah.
followed. So there's not much chance of transmission through this.
Mm-hmm.
But as a precaution, like everything else, you should try to avoid direct contact as far as possible, and clean your hands whenever you come in contact with a person like this. That's all. I mean, I think we should not panic. There's unnecessary panic on handling of the dead bodies.
Dead bodies.
Among
Only to add with this, when they go out of the mortuary, that should be more important how to take care, because we should not touch the body. We should not be too much emotionally to handle that. So that is one to be educated to the public, and the stigma is there. What sir said, the stigma when even doctor die or someone die. Yesterday
Yeah.
also I have seen in the
It's
media.
very unfortunate.
It was there,
Yeah.
someone is not allowing to do cremation. So these all to be educated, because sir said, rightly said, there is a protocol. We are able to protect it, and good to save what we are doing measures. Then no need to panic. That's only to do some things to be educated for them how to handle it, minimum handling, and dispose it in the proper manner. But respect dignity of the persons, even death. That should be taken care more. That is a message to the society.
Not so it's not just the dead body. I think
Yeah.
you people are doing a tremendous job
Yeah.
in AIMS and everywhere throughout the country and in the world, that the doctors are really the big heroes this time this time of the pandemic. So sir, with this I would like to end today's session and the webinar series, the 3-day webinar series that we conducted. I hope you people really found this information that we tried to disseminate, and we could clear some basic doubts of all of you. So I would, on behalf of IQAC of Venkateshwara College, we really would like to thank Ambod sir. Thank you so much, and all the technicians as well. We would like to thank everybody from AIMS who have been so helpful in disseminating this information. So thank you and to the audience who've given such amazing questions. We learned alongside
We learned.
you people. So it was really nice to host this webinar series. Thank you very much and have a good afternoon. Stay safe.
Thank you.